Welcome to the Hazard Class Podcast. This is the podcast where I ask my stupid questions to some of the smartest people in and around the world of emergency services. My guest this week is a board-certified emergency medicine physician who spent the last 2 decades at the intersection between emergency medicine, law enforcement, and executive protection. He's a graduate of Harvard Medical School, and he serves as a reserve sheriff's deputy and a flight physician for the San Bernardino Sheriff's Air Rescue. He's the founder and chief medical officer of Raven Medical Support Group and the chief medical officer at XPJ, where he helps build medical programs for high-risk corporate and private security teams. He's worked with NASCAR, Indy racing, motocross, raves, concert, and disaster medical teams. He even did a few seasons on television along the way. But the thing that caught my eye first is his work as the medical director for Chipotle. Do you have questions? I do too. This week we're chatting with Dr. Michael Guirguis. Dr. Guirguis, thank you for joining me.
Hey, Jake, thanks a lot for having me, man. I appreciate it.
Of course, man. I was telling you before we got on here, kind of as we got in contact originally, like I spent some time. It's always interesting how you find guests. Sometimes it's this guy knows this guy or whatever it is. I literally found you by doing what I do, which is scrolling the internet. And I was like, oh my, how many lifetimes has this human being lived? Like when you look at your resume and the experiences you've had throughout your life, it just doesn't seem possible that one human being could have done all the things. Could you ever imagine, have you had this life experience growing up?
I wouldn't have never imagined it because, I mean, a lot of what I've done is just kind of naturally kind of progressed, through my career, and some of the things I've started. So, yeah, I would have never guessed my life would have led to this kind of path. But I'm loving it. I'm enjoying it. And yeah, I mean, if you look at the resume, it look like I don't have any free time. But I think as time kind of moves on, you slowly kind of put things on the back burner and you start to kind of progress and get into new fields that are more interesting, right? I mean, that's kind of what makes life great. So
yeah. So you just count yourself as malleable to the moment, and you've just kind of found this like flow like water through these different opportunities, or how like you become a physician and then you seemingly have kind of taken every opportunity to be a physician in an atypical way you could possibly take.
Yeah, I mean, when I look back on it, it was almost like just kind of a natural flow. It went from never wanting to be a physician, playing sports in high school, wanting to be a police officer and a pilot, but having an injury that ended up kind of pushing me into, college and then pre-medicine and then medical school, but then always having that kind of not really wanting to be that hospital-based physician, always kind of enjoying out-of-hospital experiences, right? Just, I wanted to do law enforcement. I wanted to be out. I wanted to be a pilot. And it was just a natural progression, and we can get into it. But it just kind of, everything I've ever done, people I've met, it's just led to a progression of, hey, you should try this, or this opportunity's there. I'm like, I didn't even know that was an opportunity. I mean, that was basically my into executive protection was through a friend who was a PA that I work with, who had a buddy who was an 18 Delta who worked for a private family office, billionaire client, who had a security team, but who needed a medical director for the medical component of that security team. And that's kind of how I got into, what Raven Medical Support Group is now, and kind of the Chipotle and all the other clients that I have, on the Raven Medical side, and how I got introduced to the guys at XPJ, who are a bunch of studs, that are, pretty much Air Force pararescuemen, Special Forces medics. So
yeah, insane. So let's go back before we get to all of that. Let's go back to the very beginning. You kind of touched on is like, what does young you want to be? Like if you think about like elementary school you, what's the hope?
Yeah, young me, elementary school, obviously policeman, fireman, doctor, all that stuff when you're a young kid. Then as I got older, where I grew up in Southern California. I lived in Lakewood. It was right behind the sheriff's station, LA County Sheriff's, one of the substations, the Lakewood station. And they had what was called Sky Knight, which was, I think one of the first helicopters that did patrol for law enforcement, and that helicopter would land and take off 15 plus times a day. So every time I heard that helicopter, I'd run out to the front door and I'd want to, watch it land. I mean, literally 200 feet from my house, because we lived on the back side of it, and they would just have a LZ in the back parking lot where they parked all their patrol vehicles, and I would just watch it. So throughout high school, I was athletic. I played football. I wanted to be a cop so I could be a pilot. My goal was to be a cop so I could basically become a helicopter pilot and fly for the sheriff's department for 30 years. Then I had a back injury, a football injury. I had a herniated disc at the age of 16, and that basically put me out. My athletic career was done. I had basically nonstop horrific back pain, sciatica. I had it up until 10 years of finally getting surgery in my third year of medical school, but kind of prior to getting to there, I basically went from not being able to be a cop. There's no way I could have went through an academy and ran and jumped walls and things, to basically going to UCLA for undergrad, which was the local, college in my neighborhood, an hour out from where I grew up. And, from there, just kind of having to deal with doctors and physical therapists and things like that, pain management specialists, I got an interest in medicine. And so that's how I, kind of pursued that medical career. Ended up going to Harvard Med. It was one of those opportunities that you can't, kind of, not do. So, I went to Boston for, 4 years, did my medical school there. My third year of medical school, my back pain was so bad that I could barely walk. I remember being on a psychiatry rotation, trying to talk to a patient and just having to squat against the wall because there was so much pain, and just being diaphoretic and sweaty and just couldn't manage. Ended up having a great surgeon who was, a spine surgeon at Beth Israel Deaconess. One of the top hospitals, in the country, obviously affiliate to Harvard. And Dr. Augustus White, did my spine surgery, and I basically walked out of the hospital the next day. Pain-free. And so I was able to kind of continue my career into emergency medicine. And, I came back, and, that's kind of where the sheriff's department stuff came in and all that. So, and we can get into that also.
Yeah. So talk to me about the process of applying and being accepted to Harvard. Obviously, that's a big life thing. What was that like?
Yeah, because my mind was set on going to the Sheriff's Academy. When I applied to college, I help kids, my buddies' kids apply to college now and things, and they're applying to 30, 40, 50 schools just to get into a good college these days. Back then, I applied to 3 colleges. I applied to UCLA because my neighbor was a big UCLA fan. I applied to UC Irvine, and I applied to Embry-Riddle, which is a flight school out in Arizona. My dad talked me out of flight school because, it was during the time of the first Gulf War. And he's like, listen, he goes, these airline pilots are all going to be, retired military pilots that have probably got tens of thousands or thousands of hours of flight time. They're going to come in, and they're not going to pull you, as an airline pilot when they've got these guys that have all this training already. So I didn't go there. And then it was just a choice of UCLA between UCI. Now UCLA obviously is the best choice. It's probably one of the top public universities in the country, at least for sports, or sorry, for education, not athletics. Yeah. It is a basketball school and maybe a water polo school, but it's not a football school.
Yeah.
And there I went to med school, and then kind of knowing, hey, I kind of screwed up. I could have had more opportunities maybe for college, but life is what it is. You take what you get and you move on, you learn from it. So yeah, applying to medical school was a whole different thing. I applied to probably 30 different medical schools, much more expensive, much more laborious process. You're doing a lot of flying across the country to actually interview with a lot of these medical schools. Pre-COVID, now post-COVID, I think they're starting to use Zoom and doing interviews. They're not we don't need to drag you across the country to have you sit in front of us for an hour, and check out campus. We could do that after we've accepted you. And then you can kind of figure out, do you like the campus? So yeah, I mean, yeah, I just saw it as what it was. It's math, right? It's numbers. The more you apply to, the better chances you have in getting into the school. And then you can always, take some off the table after you've been kind of accepted into the secondary application or been accepted to medical school. So, I mean, I interviewed at a ton of places just because I was like, I want my ability to pick the best spot for me and not just have to go to the one school I got accepted to. And so I got accepted to Harvard. I got accepted to a numerous other medical schools. And I mean, it's just Harvard, right? So you just have to go. So I went.
So obviously Harvard is all the rage, right? If you think about like prestigious places to go, what makes it better?
So, at the time, I didn't know what made it better other than just name, right? I mean, it's just branding at this point. It's Harvard, right? It's one of the older colleges. It's Ivy League school. It's, one of the top undergrads, top medical schools, top business schools. It just has that aura behind it. But, what is medical school and what is college? It's what you take out of it, right? Mm-hmm. They throw books at you and you basically are going to be as good as what you put into it. So if I would have went to UCLA or UC Irvine or, whatever medical school, I'm only going to be as good a physician as what I get out of it, right? And obviously Harvard's going to have, the top-notch researchers, the top-notch physicians, things like that. But yeah, I mean, at the time they did this new program, which was the new pathway, which was this, you think of medical school as cutthroat, right? Everybody wants to get that A plus. They want to be the valedictorian. They wanted this. We didn't even have grades. When we first came in, I think it was either the first or second year, it was a pass, no pass system. And their thought process on it was, listen, you're physicians, right? This is not a competition. This is a field where you want to collaborate with your peers, right? You're an emergency room doctor. You need to be able to collaborate with the cardiologist, the cardiothoracic surgeon, the nephrologist. You're going to be calling each other, bouncing stuff off each other. I mean, I've had nephrologists call me, hey, I've got this patient. What should I do? I'm like, send them to us. We'll get the initial workup going and then we'll figure out what's the next step. So they did that kind of as a collaboration where people would actually work with each other during school and not just kind of hoard notes and like not help their buddy because they wanted the A in the class. Mm-hmm. So, I mean, that was actually a great experience. I think it brought the stress level down a lot where you didn't have to just you were learning to learn, not learning to get that A. And I mean, it's been a great process. I mean, I've kind of used that and throughout the rest of my career. I mean, I collaborate with whoever I can. I mean, you hit me up to do this pod. I've never heard of your podcast. I listened to a couple episodes, checked you out on LinkedIn. I'm like, yeah, I can do it. I mean, if our chat will help others maybe, see something in my career that may be interested, or, maybe, your firefighter folks that sounds like maybe is a big viewership, get interested in EP, I'd be glad to help them out. Yeah.
So what goes into your decision to go into emergency medicine specifically?
The show Emergency ER. So
of course.
It's basically, it was the whole George Clooney, ER, watch it every night or whatever it was, whatever day it was back then on NBC, and how glamorous and how cool it was. But yeah, I mean, it was in like 2002, I made that decision to do emergency medicine. I enjoyed, my rotation emergency medicine, and that was basically it,
What do you think of the show now?
There's a new show called The Pit, which I haven't seen, and it's with...
which is great, yeah.
Yeah, I mean, everybody says it's great. I just can't get myself to watch... I can't get myself to watch these shows, and I hear it's very realistic, and it's it's done well. I don't have the bandwidth to watch any more TV at this point.
Yeah, my wife is an emergency room nurse, and she's a PICU nurse, but she loves it. She was like, finally, someone does it justice. And right. I spend working in the fire service, I spend more time than I would like in an emergency room when I was working on the ambulance before. And it definitely held true a lot more than any other show I've ever seen. I thought they did a pretty decent job with it.
You probably rode the wall for many of thousands of hours in your career, and you could have probably started a side business with all the time you wasted on the wall. But but that's true emergency medicine, right? Like there's no room for people, and I've got a paramedic there that can take care of this patient while we open up a bed. I'm not going to let you go, It's a broken system for sure.
That really comes into a lot of the stuff that I think is worth talking about, which is like, the state of emergency medicine in particular in the United States is just beyond belief. Even in my career, it's went downhill so far. Is there a way to fix it?
There's a way to fix it. I think once you fix primary care, once you fix the ability for someone to be able to see their own doctor same day or the next day, then you fix it. It's not that difficult to fix. 50% of the patients I see is stuff that could have been dealt with on an outpatient basis easily.
Mm-hmm. Is it a scheduling issue, or what is it? Why is it that can't happen?
No, the Western medical system is based on specialties, right? Because specialties pay more. You know, for me to be a family practice doc, they're probably making 30, 40% less, and we're doing the same work, right? The work is the work, right? Mm-hmm. If I got to show up from 9 to 5 and I'm doing emergency medicine, even though emergency medicine may be more stressful, and this guy's just doing, baby checks or, seeing patients for their coughs and colds, we're still there, right? We're still using medicine. Fine, I have maybe some more advanced skills. I can do more procedures. But there's a huge pay gap, right? So people want to become orthopedic surgeons and make $750,000 a year, or, ophthalmologists or dermatologists. They just need to start increasing the pay and actually pushing people towards, primary care.
Who's gatekeeping that? Who's to blame?
Well, I mean, it's capitalism, right? It's supply and demand. It's, if there's spots open for a higher paying specialty, then people are going to go into it, right?
Mm-hmm. I would imagine working in, California, you probably are even more familiar with the problems than I probably am. But, in the area I work, we're dealing with, the unhoused population and like what to do with providing obviously they have a ton of comorbidities and a lot of, persistent medical issues, but also they have no capability to receive, ongoing care. And so we see the ERs just overrun with them, utilizing them, and seemingly no way that I can think of, barring making some sort of other system entirely to deal with that.
Right. I mean, in LA, we have a very large, homeless population. Mm-hmm. A lot of it is self-induced, drug abuse, things like that. Mm-hmm. A lot of it is just bad circumstance, psychiatric disease, things like that. But I mean, you ask me my opinion, I think a lot of it is drug induced. Even the psychosis and the psychiatric issues are drug induced. And I think the emergencies we see with the homeless population is from just lack of care, something that was simple that just festers into, a septic patient or, whatever the issue is. The system's just broken. But I mean, there's county clinics, there's all kinds of things that they have the ability to go to. They just have made decisions and they don't seek that care out.
Yeah, and that's for sure.
We got to call it for what it is. I mean,
yeah, that's the reality, right? And I've encountered more homeless people that I can count that don't want the help, which is really a frustrating thing. We show up and go, hey, we'll do this or we'll do this, and they're like, no, get out of here. And you're like, well, somebody's going to keep calling if you keep trying to sleep on the sidewalk. Like, we have to do something, right?
Right. Yeah, they've made that. They're adults. They've made that decision. Yeah. There's probably housing. There's food. There's all kinds of drug interdiction, programs that they can get into, and they've just made a decision. I mean, you can't force someone to change, right?
But I think that the part that might even be more detrimental to, society at large is this idea that now when, grandma breaks her hip, she doesn't have a bed in the local ER because, of the system, right?
I 100% agree with you.
Yeah,
but that's probably why you sit on the wall, because you're drunk homeless guy who we've seen 4 times this week. Yeah. Doesn't trump grandma who broke her hip, who we'd love to get pain control and get her up to an operating room, or at least get her upstairs, which I can turn that bed over. And I mean, I can get an x-ray, get her pain control, get some basic labs, call an orthopedic surgeon. And if there's a bed available, get her upstairs to a comfy bed in 4 hours, versus your homeless guy is going to sit in my emergency room in a room and take up 36 hours of my bed where I could have moved 7, 8 patients in that bed in that 36 hours, trying to detox him and, deal with, their issues.
From the perspective of, a physician working in a hospital, how handcuffed do you feel by the system and by law and regulation, like in dealing with problems like that?
I mean, there's EMTALA laws, right? So you can't just kick people out. If someone's got a place to stay, I mean, as humans, we should make our best effort to try to get them housing. But I also shouldn't have to sit on someone who just is refusing everything and just wants to kind of, have a bed to sleep in tonight. We've got shelters. And if that means we have to make shelters safer, I mean, because I'm sure shelters are not the safest places.
Yeah.
So maybe those need to be fixed. I mean, it's a whole system-wide issue that needs to be fixed. But when it doesn't get fixed, it all just kind of lands on the emergency department. Right?
Yeah. Yeah. And then now with the increasing rate of, emergency room violence against staff and stuff like that, I know that's something that's been really kind of a problem here with nurses being assaulted and doctors being assaulted based on kind of I don't know if the right word might be disrepair of the whole system. I don't even know if there's a correct answer, but it's like we just seem like we're screwing ourselves into the ground further and further without any answers to solve it. And it doesn't even, maybe I'm wrong, and maybe you're in some meetings that I'm not, but it doesn't even seem like anyone's trying to solve it, right? Everyone's just going, man, throw your hands up in the air, right?
No, I'm the biggest pain in the ass to the administrators of the hospitals because I've got that law enforcement background. There's nothing about being in a hospital that allows you to just act a fool, to assault people, to injure people, to be verbally abusive. Like, I don't care. Honestly, I just don't care. Like, if you're drunk and you decide to punch someone, how is it that in an emergency department, you wouldn't go to jail? But if you were outside of the emergency department and you punch someone, you'd go to jail. Like, how does that make any sense? Doesn't make any sense to me. If you punch a nurse who's trying to put an IV in you to save your life or, to give you medications or whatever, I mean, how is that? But you talk to administrators, they don't want to do anything about it. They're like, oh, we can't arrest. This is a patient. I go, no, this is a human being who made a decision. And if it's 80-year-old grandma who's got dementia and she's sundowning, that's a different story than the 30-year-old who's high on drugs and decides to punch you or stab you with a pen or whatever, or a knife that he's got in his bag. You see it all the time in the back of ambulances. You push Narcan and, a medic gets shot or stabbed. There's no, you go to jail. Like, that's just normal. You're done. You're in danger.
Yeah, we still need rule enforcement, despite the fact that we're here to provide care. I don't know. That seems like there's a gray area there that there's a disconnect from administration to the people on the ground, Yeah,
I would say there's a bigger push towards, making these people accountable for what they do, patients that are violent. If I'm ever assaulted, you're going to jail. Like, I'm pressing charges on you. It's just, there's no ifs, ands, or buts. I mean, unless there's extraneous, reasons, like I said, the 80-year-old grandma who punches me because she doesn't know any better, I'm okay with that. Like, that's not a big deal. That's not someone I would press charges on in the street if they came up to me and hit me or, we're just out of it. If you're just drunk and you're an ass, then I'm pressing charges. Like, I don't care.
So getting back to kind of your timeline here, it's like you come out of med school, right? I'm sure you did residency, and then did you do an emergency room fellowship as well?
No, yeah. So out of med school, I came back. I came back kind of with 6 months because I knew I wanted to do a program at Loma Linda, which is here in Southern California. It's a level 1 trauma center. They'd had a working relationship, and remind you, I had back surgery in my third year of residency. I was pain-free. Like, I've never been pain-free for 10 years. And I could actually now start to do things. So, I came back with 6 months. I did some research at USC. I did some rotations at USC, the emergency room there. And I knew I kind of wanted to go to Loma Linda because they'd had a working relationship with the sheriff's department doing air rescue. So I ended up going through the Sheriff's Academy in my fourth year of medical school while I was back home. And it transitioned a year into me starting residency at Loma Linda. So, you know, I applied to Loma Linda, I applied to UCLA, USC. I knew I wanted to come home. I was done kind of going anywhere. I could have went to Mass General, did ER residency at Boston and been a Harvard doctor the rest of my life, then had to live in Boston. I wanted to come home. I was ready. So I went to the Sheriff's Academy. You know, that my residency director at the time was a military doc, an Army doc, and so he loved that I wanted to come in and be a sheriff's deputy and fly air rescue. And I started flying air rescue, almost that first month of starting, internship and residency. So I did a 3-year emergency medicine residency at Loma Linda. EMS fellowship was still kind of relatively new. But I had done so much work in EMS just as a resident. I mean, I was working NASCAR. Our Auto Club Speedway at the time was right down the street, 20 miles from us. So I was doing NASCAR. I was working in the Info Care Center. I was doing track dock, sitting in the vehicles, just waiting for something to happen on the tractor in the race. Indie racing, we do indie racing, a lot of raves, concerts. We have huge concert venues here where there's 60, 100,000 capacity open air venues, Ozfest, all the big concerts you could do. So you get that kind of mass casualty event medicine feel. You get the in-hospital feel. I was getting the air rescue. I mean, we weren't just a kind of a transport. I mean, we were actually a rescue. I mean, I've hoisted probably 100 plus folks off the mountains, gone out into, the highways from here to Vegas. It's just all barren land, taking MVAs back to the trauma center, hoist rescues out of the mountains, swift water rescue. I mean, we do it all. So I was like, what is the EMS fellowship going to get me at that point? I'm ready to get out and make some money, man, because I'm 30 plus years old with, hundreds of thousands of debt, and I don't want to do another fellowship. I see it almost as, I hate to say it, but slave labor. It's like you're making pennies and you're basically functioning as a physician. So I was just ready to make money. And I can kind of continued in all that EMS stuff. I mean, I've worked with professional hockey teams, the LA Kings, Ontario Reign. I was the team doc there with a buddy of mine who was an orthopedic surgeon for 5-6 years, and then kind of had to put that on the back burner once I started having kids, because it was a big time suck, especially on the weekends and Sundays. But yeah, I mean, just along the way, just opportunities they just kind of fall in your lap, and you're like, oh, that's great, I'll do that, that's fun, get to go to hockey games and have access and bring family and friends, and they get to enjoy. And it's always a good time.
Yeah. So as you kind of went more and more, you moved more and more out of clinical medicine or in hospital and more out. So talk to me about that. I think it probably goes in line with a lot of the stuff you've already said in terms of like being able to make more money, being able to like have more unique experiences. But was it truly just like following the breadcrumbs, or was there ever like a conscious decision that happened to say, I want to be outside of the walls of a hospital and I want to do something else?
Well, it's not following breadcrumbs. It's a conscious decision to want to be out, because I'll tell you now, EMS medicine doesn't pay as well as, an ER shift, but that's kind of I've always had a financially sound mindset where it's not about making money. It's just about making enough money to be comfortable. And you don't really need more than that. And now it's a matter of, what do I do that I can have kind of just enjoy actually what I do. I mean, after 22 years of emergency medicine, you get burned out. Like, you're dealing with just a lot of nonsense, right? And you're just like, okay, fine, I'm making good money, but I'm not happy. I dread going into shifts now sometimes. You dread going in on Christmas Day. I mean, I had to miss Thanksgiving because I was going to work. So I had to have Thanksgiving with my family on Wednesday. So there's just there's a lot of things that you have to give up when you're doing emergency medicine, because it's not your specialty clinic where you're Monday through Friday, no weekends, no holidays. So I've made a conscious decision to slowly, I do max 2 ER shifts a week now. And the rest of the stuff is pre-hospital care, executive protection, and mostly just family. I mean, I've got a 7 and an 8-year-old that, my goal is to be there for everything. I mean, I drop them off 3 days out of the week to school and pick them up. And I try not to work on those days when I'm, dropping them off and picking them up. That's just a conscious decision I've made.
I think that's an interesting thing because me and my wife kind of sitting in different parts of this. So I have a 7-year-old and 9-year-old. And how has your work in emergency medicine informed your parenting?
How has it?
Yeah. Are you a hover parent or are you it's fine, we'll fix it later?
I think I'm probably more of a hover parent because I've seen a lot of crap. You see a lot of crap that happens. I mean, I've seen kids that have drowned, so I'm hyper vigilant when they're in the pool. I mean, my kids can swim like fish, but that doesn't stop them from, slipping, falling, hitting their head, going unconscious and falling in the water, right?
Yeah.
I mean, if an accident can happen, it's going to happen, especially with kids. I mean, my kids had to be, my boy's been in the emergency department a few times already with a split lip, and I was out of town, and, his mom had to take him in, and I had called up my buddy and said, hey, put some stitches in there. But yeah, I mean, I would say I'm probably a hover parent just because I know when bad things happen, they can happen, and I'd rather try to prevent them before happening. But especially with little boys, you can't. It's impossible to prevent it.
I'm on team hover parent, whether I like to be or not, right? I think that I'm totally with you, which is the idea that like once you realize that nobody plans to have an emergency occur, right? Everyone thinks they're going to be safe, and everyone thinks nothing bad's going to happen. But my wife working in similar field or similar enough field, she always has to try to temper me, which to her credit, I mean, as a pediatric ICU nurse, she is, in the shit, like as much as you could possibly be. But she somehow is more tempered than me. I don't know how she does it because I am like, don't do that. Don't do this. You're going to die. Right.
Yeah.
But,
exactly.
Yeah. But, so how else, do you think it's impacted your view of the world, not just in parenting, but, do you find yourself, being jaded or burnt out towards the world in general? Or how do you manage a 20 plus year career in emergency medicine, and be relatively well adjusted, it would seem?
Yeah, I wouldn't say I'm jaded to the world, but now that I've got kids and a family, my goal is to just keep them safe. Where when I was younger without kids, I'd go out and I'd help and I'd do this and that. But I've seen car accidents where I won't stop because I know that if I pull over and if I leave my kids in the car, I'm going to get some knucklehead that's, texting and driving, and they're going to barrel into the back of my car and kill my kids. Like I don't do things when I'm with my kids that I would have done without them. Because I've seen it. I mean, I've seen you drive and you see people texting and they're, already coming over to the next lane. I mean, you've seen the videos of, police officers doing traffic stops with lights on, and someone comes and barrels into the back of their car and it wipes out their car. Like, I can't do that. So, I'm not going to say I'm jaded. I will say that, burnout is a real thing. And I know it's a big thing in the fire service and in law enforcement and just kind of all this pre-hospital EMS, or any kind of service where you're helping people and you're also exposed to some of the worst, right? So, it's very easy to get jaded.
Yeah.
So
how do you manage? How did say you're at work, you're dealing with, one of the bad ones, right? One of the ones that stays with you a little bit. What's your process to maintain?
My process to maintain is knowing I only have to do it twice a week now. I mean, it makes it a lot easier to have to deal with something when you only got to do it twice a week and you're not doing it 5 days a week, right? You're like this, and and this will pass, and you just kind of keep going. I don't feel like I'm a prisoner to it anymore. I've made active decisions to work with this clientele or to work with this clientele and to enjoy this field where my skills are appreciated, may not even be used that much, but the ability for me to be somewhere and have that skill set that may save a life if something were to happen, it's just you feel more valued and you just start to enjoy it. And you start to work with other folks in a different industry that just don't see the world as maybe, we've seen it in the medical industry.
Yeah. So you talked about how you kind of first broke into, the executive protection world and doing some of that, just kind of like a friend connects you with this person who connects you to that person. What was that adjustment like in getting, I'm sure you probably had a limited experience with executive protection at first, right? You worked in the sheriff's office, but executive protection is probably slightly different than that, I would imagine. What was that like?
I mean, law enforcement and EP are they're not the same whatsoever, right? And I didn't even know what executive protection was. I mean, I was a bouncer in college. I used to work in Orange County nightclubs, and I'd had that mindset, that security mindset. I was always good at kind of feeling the aura of the room if something was going to go down or something was going to go down in a crowd. I could be halfway across the room and just see the pattern of the way a crowd moves and changes, and start to realize, oh, something's going to pop off over there. You just start to you tune into that, right? And that's. I mean, now when I'm with my kids, I mean, like if I even get the sense of something that's going to go sideways, I'm like, we're going this way. So this happened in 2000, right before COVID. A buddy of mine who is an orthopedic PA came up to me and said, "Hey, I got a buddy of mine. He's an 18 Delta. He now is retired. He's working in the private sector up in Silicon Valley." And they've got a client who's a billionaire who's got a security team of 60 plus for one client. Yeah. I mean, crazy. And this is the norm up there. And when I say that, it's, residential teams for this house, a security team that goes with him, a security team that travels. It's wild. I mean, it's like a mini security agency. And they had pararescuemen there, and that's how I kind of got introduced to the PJs. I didn't know what a PJ was. I had no clue, and over time I learned. And they're all paramedics, right? And then you can't just perform paramedic skill set without medical direction, protocols. The industry well. A lot of folks in the security industry don't know that. They just think a paramedic is a paramedic and they can go do paramedic things without any oversight. They don't get it. And that's the biggest thing is education. But kind of getting back to the story, so I ended up interviewing with them. They flew me out, checked out the digs. I mean, huge security operations centers. I mean, buildings that you wouldn't even think of that are in commercial districts. I mean, they've got garages and SUVs and training centers and ranges inside of it. And I mean, just it's crazy, right? And so I was their med director, set the protocols for the medics, ordering of medications, things, traveling. We do a lot of advances. I didn't know what an advance was. I mean, I've always done, pre-hospital planning, but they call it an advance. So, I mean, when a client is traveling, we're looking at where they're traveling, closest ERs, capabilities of the ERs, the hospitals, which ones are the stroke, STEMI, pediatric hospitals. So all that is kind of all pre-planned out. So when they travel, we kind of know if something goes sideways, what are we going to do? And it obviously depends on our families, our kids traveling, having all the pediatric equipment available if there's going to be, kids around. And it opened up my world. And then from there, I mean, I just got exposed to all the different, I mean, the Googles of the world, the Apples of the world, the Microsofts, the Ciscos, all these startup companies, AI companies, they all have security teams, right? And everybody thinks security for them is going to be IT security and things. No, they've got executive protection teams. They've got, CEOs, they've got C-suite execs that kind of get into the political space. And when you get into that, then you've got people wanting to kill you and threaten you. And it's a very interesting world, seeing that.
How do you go about making protocols for an organization like that in terms of like what you're going to allow them to do underneath your medical direction and what you don't want them to do?
I mean, it's just like, your fire department. I'm assuming you work for a fire department. You've got a med director, and your protocols are kind of based on, your state and maybe your county. Here in California, it's a big cluster. I mean, you've got state licensing as a medic. Obviously you've got your NREMT, then you got state licensing, and then it even breaks down into county. Each county or multiple counties have an EMS agency attached to it with its own medical director. And this county may be different than this county. Like San Bernardino County, we can give ketamine for pain. If you go into LA County, they don't give ketamine for pain. So even each county, that could be, bordering each other, they have different protocols. So in this, we set up protocols based on obviously their skill set, right? I mean, I've got PJs that I'm comfortable pushing RSI and intubating. It's difficult because the EMS agencies is not built. Our current EMS system is built for medics, fire medics, or paramedics or EMTs that work in a local area, right? Under local medical direction. Our guys travel. I mean, they may be in Vegas one day, they may be in Southern California the next day, they may be in Montana for 2 weeks, and then they may go to Ibiza for a week. So
that was gonna be the next question, which is like, what's the legality of if you're a California certified medic and now you're in Illinois and then you're in Florida and this drug is legal to push here and legal, are these people literally they're on the plane flying to Illinois and they're studying their sheet about what they can do in Illinois? Is that kind of how it works, or how does this work?
Yeah, I mean, pretty much. I mean, we don't fly with narcotics. Okay. So we just don't do it because that's just a whole new, worm we don't even want to deal with. I mean, most medications that we carry are usually legal in all the states. I mean, there's nothing, Epi is not going to be, illegal in Illinois somewhere. And it's difficult. I mean, the big thing is we're kind of private contracted and we don't treat the public whatsoever. We're not a 911 service. We're not a service that is providing for the public. We're strictly providing for our client.
So in that, are you granted much more latitude because it's just basically an agreement between you as a physician and the client, what they want?
I mean, yeah. I mean, when you think about it, it's if I were to go, if I'm on a plane over Chicago and something happens and I use my medicine skills, is anybody going to come after me?
I mean, hopefully not. I don't know. It's pretty litigious out there.
Yeah, I mean, well, but you're on a plane and you save some guy's life. I mean, I didn't open up a clinic and start practicing, emergency medicine somewhere. I mean, that's not what we're talking about. Or when you think about, these medevacs, if your wife is a PICU nurse and they have a PICU patient they need to pick up in Chicago, is she not allowed to pick up that PICU patient in Chicago and bring him back to California? She's not licensed in Chicago.
Mm-hmm. Yeah.
The system's just not, I don't think anybody makes a big deal about it when you're just kind of doing things on the run and you're here, there. You can't get licensed in every state, every county. It's just impossible. Like I said, the system, we're working in a system that's not built for this. And we just have to sometimes just take liberties and do what we need to do for our client.
What do you think is a misconception about executive protection that someone might assume and that's not correct at all?
I think for executive protection, there's higher level medical training that is needed. Maybe not in every scenario. I think the misconception is there's a lot of these classes that are being taught like TECC or TCCC if you're from the military, that if you take it, somehow you're like some well-trained professional. And then when you kind of look back on what the curriculum is for that, it's basic tourniquets, stop the bleed training, maybe a little airway CPR. But we all know that's not gonna help you when the 60-year-old who's got CHF and asthma starts having shortness of breath. None of that training is going to help you there. Yeah. If you don't got the Lasix, if you don't got the medications, if you don't have the ear to listen for the difference between a wet lung and, a reactive airway lung, and you can't tell the difference, you're going to have no clue what to do. So if you're not, I mean, even, and I say this, and look, my EMTs, I love my EMTs, but their scope of practice is not going to be able to treat someone who's in CHF versus asthma and who's short of breath. Mm-hmm. I mean, especially here in California, it's like you can't even really do an EKG as an EMT out here. Mm-hmm. You're not allowed. It's not even in your scope.
Wow. That's so then how challenging does that become to be able to staff those teams with the appropriate people? I mean, is that a thing that you're even involved with in terms of like, there's someone's going to travel across the country. We need to make sure that they have this person, and this person with them.
So I don't deal with the security side of it. So let's, for like my private family office, I was given an example for, in 2000, and I was there up until about 6 months ago or so. That the security is the security. And now if you've got a medical person, and most of these people can't afford, to have a team of medical folks on that staff. I mean, this client could. But what we do is, that's kind of how I work with XPJ. So XPJ is a group of, I think there's 30 now on the roster. They're all retired or reservist Air Force PJs. They're all paramedics. They've all seen duty, mostly obviously in the Middle East. They're well trained. Some of them still work as paramedics in the local areas that they're working. And what we'll do is we'll take them, we work with clients, and we'll just embed with their teams, right? So we're there as that medical component. They fall under my medical direction. They're licensed, they're insured, everything through XPJ, and then they'll just embed with the team. So if we've got a client that's going to go to Greece for a week or has to go to New York for a week, if we've got a New York-based, PJ, then we'll send them. If we're going to Greece, we may embed with a local, kind of for legality's sake, we may embed with a local medical personnel there, but we already know that we've got our guy there on the ground, so we have to kind of play by the rules. A lot of times we'll just have someone just come with us, and they're just there with us, and they're telling us, hey, we could do this, we could do that. They know the local area. Almost just like a guide for us. It just all depends how much time we have and to plan it.
Did you feel like you had to learn, what was the spin up like when you got into executive protection primarily? Like, did you feel like you had to learn this whole new sea of information in order to be valuable in that space, or what did you have to do?
Yeah, I learned on the go. Because I had the 20-something years of law enforcement, and I've done kind of the bodyguard security work at nightclubs. I've always had that protector mindset. And then you just start learning as you go. I do events in LA all the time where it's, I'll do the security side of it. Oscars, Grammy parties, Emmys. I've done work with Apple TV. I've done, work with a lot of the big companies down here in LA. I try not to travel too much, just because, I've got young kids and I don't want to be gone I've been offered, 6-figure money to go sit on a boat for 2 weeks, with clients during, but the problem was it was during New Year's Eve, Christmas Eve. It was kind of in that end of the year, early January. I just didn't want to leave my kids for 2 weeks and miss, all those holidays. So we sent another physician. It's you just kind of learn on the fly. There's EP schools where you can learn EP. I don't drive. I don't need to take driving courses. There's a lot of stuff that I'm not going to do. But I think I'm probably well adept. A lot of the times these full-time EP guys, when I can go do an event, I'm usually in the mix because of my skill set, and it's usually pretty good. But I'm not that guy that's doing covert kind of protection where I'm plain clothes following our principal, through the city where it's not obvious. It's not like the Kim Kardashian where you've got the big 7-foot, 400-pound guy following her doing, bodyguard work.
Yeah.
These aren't the clients that you're going to recognize on the street. So they don't want that kind of overt protection. They want that covert protection.
So as you get to work with these people kind of in these, industries and positions that are kind of, unknown, but very important, and, how do you go about navigating those relationships and, being there, but being in this behind the scenes? And, obviously I'm sure they probably want to have some level of relationship with you for the sake of rapport, but that also you need to be in the shadows. Like, how do you navigate that?
Yeah, so because of kind of what I do, a lot of the times I work specifically with the chief security officers, who basically are kind of the CEOs of the security kind of corporation that the client has. So I'm always, face forward with those guys. obviously I'll get introduced to the clients. They know who I am. Nobody ever sees me. They'll look at me like, he's the doc. Like, I just don't have that. I don't have that doctor look. I don't have the doctor build. So, they just kind of question it. It's funny. I mean, I've come into many a patient's room with a white coat. Usually I don't wear the white coat, but even with a white coat and scrubs on, with MD on, on my scrubs, and be like, well, when am I going to talk to the doctor? And I'm just like, I mean, I get it. I've never looked like a doctor. I don't want to ever look like a doctor. My goal is not to look like a doctor or even act like a doctor. And I think for me, it works well. The day someone says, "Oh yeah, you look like a doctor," is going to be the day I'm like, I'm done.
You're done. Yeah.
Yeah, this sucks.
So talk to me about your time. You did a bunch of TV. I'm interested in that, like with how you got involved with that. Is that just you happened to be in LA and they were looking for a doctor?
It was another thing that fell in my lap. I had a girlfriend of mine who I worked with, and she had done, there's a TV called Sex Sent Me to the ER, and it was on TLC or one of these shows, and they filmed right down the street in Pasadena. They'd taken over like an old psychiatric hospital, and they converted one of the rooms, or one of the buildings, into like a studio that looked like an emergency room. And I just started doing kind of cameo appearances. I don't even know what they call it, but like, where, they show the scene and then they have the doc pop up and talk about what they're seeing and what have you. And then that kind of rolled into the same producers, the executive producers did Untold Stories of the ER, which was a show that I did a lot of. I don't know, I probably did 5 or 6 episodes. That was a little more difficult because they filmed in Toronto. Well, they actually filmed in Vancouver for the first 4 or 5 years, and then they moved over to Toronto. So yeah, they'd fly me up. We'd have a story that, it was a story based on something I've seen in the ER, and then they do the Hollywood magic to it and embellish it and, add spice to it. And we'd fly up there and they'd pick me up from the hotel and we'd do a reading, and then we'd do rehearsal, and then we'd go film it for a day, and then I'd fly home. That all happened up until COVID, and then they just kind of stopped, all international, because it's in Canada, right? The international travel across, borders and things like that, and they put it on hold. So we'll see if they come back with it. I'm sure if they do, they'll be hitting me up to do more episodes. But I mean, it's fun. It's a different experience. It doesn't pay well. You're not going to get rich. I'm no George Clooney, living in Italy somewhere in a mansion. But it's for the experience, for what it is, it's interesting.
Yeah. What was that decision like to, you become a doctor, all these things, and then now you have like this public persona. Now you're going to be this guy on this TV show. Granted, albeit it is a cameo, but still, you're no longer anonymous doctor guy. Now you are a person that is known as, this public figure. What was that decision like?
I wouldn't say that I'm anywhere near famous. So it started off as cameos, then it started when Untold Stories actually became you're the doc acting in the actual reenactment. So it was basically me as the real guy. It was me as the the real doc, and then a bunch of actors who were reenacting. So that was actually more fun because you get to basically, you're not really acting other than you have lines that you kind of have to remember, but you could take liberties as the doc. I mean, if you're going to say something medical, you're just going to say it, but it was fun. I mean, it's a very interesting experience that you could film for 8 hours in a day, and then they cut down that 8 hours into the, 20 minutes that is spread out throughout the show. Yeah, I mean, I'll know when, and these are my single days, I'll know when I was, airing in a different country because I would get Facebook messages from like people in Brazil, at 2 a.m, like, oh, we saw you. And it was interesting because your name's out there. They use your real name, so they find you. Right. And so I would get messages and all kinds of just madness. But I mean, it's fun. For what it was a good experience. I'd do it again. This time I try to see if I can get my kids out there so they can go see another country and have fun, and maybe, put them in the studio and just let them just kind of watch TV being made.
Mm-hmm. So, now that you've, started this business with Raven Medical Group, what was that like when you were like, okay, now I'm going to actually start my own business, do all these things, independently, right? I assume you were probably working for somebody for some period of time doing this, and then now or from the jump, did you split off and do your own thing?
Not from the jump. I kind of split off and did my own thing. Yeah.
Okay.
I mean, once I got introduced to kind of executive protection, I was like, I saw the need for it. Started talking to other guys, other teams. I mean, I met the guys through XPJ from, another organization that had them, and they wanted to split off. They wanted a med director. I was the natural fit for those guys to be their med director and their chief medical officer. And then just basically everything else is just kind of, I don't want to say fallen in my lap, because I've had a presence on LinkedIn. I mean, I write a lot. I talk to a lot of people when I do work, and they find out that, I'm a doc. Obviously they know I'm a doc, but when other people find out that I'm a doc, it's that this industry is not about a resume. This industry is about you as a person and your trustworthiness. I don't care what your resume shows. You're not going to break into this industry unless people kind of know you. You could break into it, but you're not going to really go high up unless people know you, they trust you, and they know your dirty little, that you can keep dirty little secrets. Because in this industry, there's a lot of dirty little secrets. Clients don't want. I mean, I've never signed so many NDAs, in my life. Other than in the last 5 years, I probably have 30 different NDAs that I have that I have to be careful on what I say and who I say it to. Because of those NDAs, because there's a lot of stuff that goes on that just people don't want to know. I mean, these are big figures in tech, industry, corporate America that, we all know people have secrets, and they need to know that the people around them are trustworthy.
So I don't know if you'll care to comment on this, but I am interested based on your career, which is, the world of executive protection has come more to light recently with Charlie Kirk's assassination.
Yeah.
Working in the field of executive protection, what do you make of that? It seems so strange to me, like some of the circumstances around it. Like I not in terms of like a conspiracy theory or something, but just in the terms of like, I don't know how a situation like that can transpire when they have the resources that you would think that they could have to prevent it.
So I think that's where politics gets involved. So, I mean, I think if people stay out of politics, politics is just one of these things that just, we're so like two-sided on it. It's them versus us. I mean, and I think politics has just made the world, just made it crazy, right? It's us against them. And there's a bunch of weirdos out there that will go kill you for your opinion, And when you think about it, I mean, our own president had 2 attempts on his life with the Secret Service.
Yeah.
With the teams I work with do not have they could have the capabilities of the Secret Service, but the Secret Service has capabilities that we legally can't have in the private industry.
Yeah.
And a lot of the CSOs I work with are retired Secret Service. I mean, this is the natural progression for the first private family office I worked for. He was retired Secret Service, but they just don't have they don't have the capabilities to put up a GPS scramming in an area where their client's going to be, that's going to take out drones and whatever else, where the Secret Service does, right? I mean, they've got that federal ability to do that.
Is it just kind of a matter of, it doesn't matter how well you plan and prepare and set the stage, chaos, can win?
I mean, I hate to say it, but security, I mean, if there is a will, there is a way. And I'll say it, by the grace of God, President Trump didn't get hit with a fatal shot. That's luck or a grace of God. I mean, there's no ifs, ands, or buts about it. But someone got a shot off, multiple shots off on him.
Yeah. With
the Secret Service there. Like, how does that happen? I mean, if there's a threat, there's a way.
Yeah.
You can't, if you miss that 0.1%, that's the 0.1% that things bad can happen. But that's why a good medical team is necessary for something like that. You know, commenting on Charlie Kirk, I don't think any medical team, with that fatal shot that he took, look, we're not God. We can only do what we can do. If you take a fatal shot, I don't care if you've got the brain surgeon or the head and neck specialist that can operate within 2 seconds. That's the fatal shot is the fatal shot.
Yeah.
It is what it is. But our goal is to try to mitigate something that may not be fatal from becoming fatal by having hands there that could actually help mitigate that.
Yeah. So that sorry, I lost my train of thought. I'm thinking about that statement, which is like, it doesn't really, you can't do anything. When the bad thing happens, if it's bad enough, it doesn't matter all the planning and preparation, right? Obviously in this world, it's all planning and preparation, right? Hopefully, very rarely do you ever have to actually use the skill sets that you've created and are preparing, right? How do you maintain sharpness and capability when you're very rarely actually using the skill?
Well, but that's why for me, that's why I keep doing emergency medicine shifts. I will never stop doing emergency medicine shifts. I will just get to the point where I'm doing one shift a week or maybe one shift every 2 weeks because I don't want to lose that skill set. I mean, I've taken time off where I'm gone for, 2 months when my kids were born and I'm rusty after just 2 months,
What about the people that you oversee in terms of these PJs are the best in the best, right? They are. But when you're working in an executive protection detail and hopefully you're never using your skill set ever, what goes into making sure that if they ever have to use it, they're ready?
So a lot of them work still in paramedicine, and the majority of them are all reservists. So they're always training. Okay. I mean, some of these guys will go back to their home base and just train with the guys that are, the newbies coming in. And they're water specialists. They're technical rescue specialists, rope rescue. I mean, they're not just, the paramedics. So all those skills are helpful.
Yeah.
We'll do work on yachts. I mean, that's a big thing in the industry is, these guys have these huge yachts with 30, 40 plus employees with support yachts sometimes, that have their toys and their helicopters and what have you in tow. And you're out in international waters or you're off the coast of a third world country or you're off the coast of a first world country, but you're still, docked a mile offshore. You need to have that medical response then and there because even if I can get the helicopter to pick you up off the yacht and take you to, we still have to land somewhere and transfer an ambulance. I mean, there's going to be a long delay in getting you higher level of care. So, it's important for our guys. And these guys are all water, rescue, rope rescue, obviously paramedics. And it's just nice to have if something happens. And we don't want anything to happen, but you also don't want to be that guy that says, well, why didn't I have medical folks on here when I'm worth this much? And it was only going to cost this much. It's like car insurance, right? We all have to have it, and we hope we never use it. And if we have to use it, well, then wonderful. Yeah. But you don't want to be that guy that didn't have it.
Mm-hmm. So that brings me to my the most recent career update, which we have to have a little bit of discussion about, which is your work with Chipotle. Which, for those of the people in my life that know me, nobody likes Chipotle more than me. I've had Chipotle 4 times this week. And so the first thing that caught my glance before I knew every other 1,000 thing that you've done in your career, right, which is just sucked me into this. Well, who the hell is this guy, right? I saw you on, medical director for Chipotle, and I said, what on earth kind of job is that? And now obviously I have a little bit more understanding, but how on earth did you even get into this position where that would be a job?
Yeah, it was something that, their CSO, we connected. I'm not like the guy checking temperatures of carne asada or anything like that. We don't do any food industry type thing. I'm sure they have scientists and specialists and folks that kind of deal with all that. But yeah, I mean, they're just the CSO is just a forward thinking person. He's also a paramedic, and he knows that they do lots of large events. They host lots of general managers, employees at big conferences, and they just know that when they have that many people, in a building, not only are they going to provide security, but they also want to provide kind of medical in case something bad happens. It's just a company that is just decided like security entails medicine, and we want to have folks available in case one of our people get injured, hurt, what have you. Even if it's something small and we can save, that employee or that executive a trip to an urgent care and ER and miss now 3/4 of that day of collaborating with their peers and an important meeting that they want to have, that's something that they're willing to provide to their employees and their folks they work with.
Yeah.
And so that's what we provide. I mean, we've chatted, we've got guys on security teams, and we're putting them through EMT schools, and we've got EMT advanced and paramedics that have a medical capability now to not only protect those employees, but also to provide medical. But yeah, no, it's been interesting. I mean, I'd like to see a day when all these large corporations have that kind of built into their security program.
Mm-hmm. Do you have some sort of Chipotle black card that gives you free Chipotle everywhere you go?
If I needed Chipotle, I'm sure I could call my buddy Josh, and he would take care of me. I actually have a few. I have a few codes that I could use if I needed a meal. So I'll probably never go hungry with those guys.
Oh man, that might be the best benefit of all.
I'll never go hungry. I mean, that's what I told him. I said, hey, if I come on board, I got to be able to, have some Chipotle. And he's like, I'll take care of you. Don't worry about it.
So as we start to look to maybe wrap here, what's the future? What are you hoping to do with the rest of your career still?
I mean, I don't know the future, because every time I think that I'm happy and content with something, it's something else pops up. And, if you would ask me this 5 years ago, I would have thought, maybe I'll, just do a couple more years of emergency medicine and retire. But, then this came along. I mean, for me, because where I see it going now is more the executive protection, me being able to pick the clients I want to work with and do events that I want to do instead of just having to go in and do, ER shifts. I think the future for me is going to be just to continue to just kind of work in this industry. For me, I really want, and that's kind of my whole existence on LinkedIn, is to just continue to educate the security industry on what true medical capabilities are with their clients, and not this false sense of, this guy took a TECC course, 16 hours over 2 days, and this is our medical guy, this is our medic,
Yeah.
The bane of my existence is when they call like the EMT the medic, or they call the guy that went through TCCC the medic, and I'm like, the medicine is complicated, kind of this terminology. So we have to kind of fix it, because what's going to happen and what's already happened is they thought they had medical until something bad happened, and then they realized like their folks couldn't do anything, had no meds, no nothing. And then I get the phone call, and then we fix it.
How far off do you think the industry is from doing it correctly?
Years. I mean, I've done it for 5 years, and I've seen a small progression. And I mean, I've just seen the small progression in terms of the people that reach out to me and realize, hey, this is important, and then it becomes now we got to talk to, the C-suite execs and make sure that they're on board, or they got to, but it's going to happen sooner or later. When you start to see the Charlie Kirks or what was it, the CEO of
United Healthcare? Yeah.
Yeah, I mean, bad things happen in this world, and then what I've realized is most people are reactive. After something bad happens, then they want to fix it. And I'm just trying to get people to be proactive in the industry because I know bad things will happen. Right now, it's like the school of fish theory, right? Right now, we're just a big school of fish, and everybody just is like that one fish of 1,000, and they know something bad's going to happen. They're just hoping it's not them until it is them. And then people start getting fired and why didn't you this and why didn't you that? So I'm just trying to make sure that each fish in that school is protected. That doesn't mean that bad things aren't going to happen and bad things inevitably happen to a client or what have you. But at least we tried to mitigate that.
Yeah. So, in the protection world, what kind of burden do you feel in terms of, it's not just like you waiting for somebody to come to you with an ailment. You are like the guardian of this person or these people or this organization. Like, how much personal burden do you feel in that kind of space to do things correctly and ethically and all the things?
I wouldn't call it a burden, but I'm not there to wait for something to happen. I'm there to make sure that things don't happen. So if I can look at you and say, hey, listen, you probably drank too much last night. You're going to need to start hydrating. Hey, here's the electrolyte packets. You need to drink a couple of these before you go to bed. Or, hey, looks like you're probably getting sick. Or, we try to mitigate things. I mean, these guys don't want to be sick. They've got important meetings. Every day is a meeting here or there. They don't need to get the flu or COVID or, what have you. We just try to mitigate, things. I mean, it's like having a concierge doc or, concierge medics that are able to kind of provide support kind of throughout the whole trip. We're not just sitting somewhere waiting for, you to fall and trip and twist your ankle or whatever. So yeah, I mean, there's a component to with that advance, depending on where they're going, vaccinations for yellow fever or whatever, depending on where they're going. Or I had a client recently want to go climb Kilimanjaro. So, obviously we start having to plan for that. We're starting to write medications to help with altitude sickness and making sure that they're taking them a couple days before and that they have doses to take with them. I'm not climbing Kilimanjaro. The PJs are, those guys are, that's their, bread and butter. But to make sure that they have the equipment that they need up there.
Yeah. So through all this, right? Through all the twists and turns of your career and where you've landed now, what makes you most proud about the journey? What would you, if you could only hang your hat on one thing, what would you be most proud of that you've done so far?
My kids. I mean, that's my kids. I mean, I waited till I was 40 years old to have my kids. I waited. Obviously I was in school. I was busy. I was working. I was having fun. I was doing hockey and hanging out with hockey players after the game at the local, yard house after, a big win or whatever. I was just having a good old time. But a lot of things changed when I had my kids. My whole focus was on what am I going to do to make sure that these kids have a good life where they're not spoiled. I will not spoil my kids. And just make sure that I'm there, I'm present. I have the ability to be present with my kids while they're young. I don't fault anybody who doesn't. I mean, I'm blessed with a career that pays me well. And I can be there, I've made a conscious decision to make less. So I'm there with my kids. I'm separated. I have my kids half the time. So I've made a conscious effort that when I have them for 50% of the time, that I'm there with them, that they see their father, that I'm there at their chapel when they're doing little, reading their Bible verse or, dropping them off at school, picking them up from cheer or whatever sports, that I'm dropping them off at soccer, watching their soccer practice, going to their games on weekends. Sometimes I can't, but that's less than 5%, less than 10%. I've just made that effort for them. And as they get older and as they don't care to see my face or want to hang out with their friends, then I can kind of pursue other things because I know that time is coming because I see all my other buddies who have teenagers that or kids come back from college and they don't even want to hang out with their parents. They want to go hang out with their friends. I know it's coming. I know it's natural. It's not nothing against me or against them. Then I'll just start to do, I'm young, I'll turn 50 in 6 months from now. So I've got another 15, 20 years in me. I'm not worried about it.
Yeah, I mean that is a terrifying thing on like I said, I have a 9-year-old and a 7-year-old, and that prospect of the days, like both my kids still think I'm cool most of the time.
Yeah.
And my 9-year-old now is a girl, the older, and she has her days where she doesn't think I'm very cool anymore. And I'm dreading this day when that I'm not cool for a decade or however long that's going to be. And how do you as a father stay engaged to, I guess I'll speak from my own experience and get your comment, I suppose, which is like, it's hard sometimes in the thick of it to remember that these moments are the things that you would trade anything in the future to come back to, right? How do you find yourself staying grounded in those moments?
It's hard. I mean, because having a 7 and 8-year-old boy and a girl, they'll try you, and I lose it. I'll lose it sometimes. I mean, sometimes they fight just to get my attention. Like, it's like, why are you guys fighting? Like, this is crazy. And then they're hugging and playing. 5 minutes later. Mm-hmm. Yeah, I mean, that's human nature, right? You don't miss it until it's gone. You don't say I love you until it's too late. Mm-hmm. And you'll hear, folks on podcasts, and, I remember Shaq basically saying, I watched something where Shaq was saying his sister was dying of cancer, and he had to go to some meeting, and she's like, go, go, go. And he didn't say I love you before he left. He figured, hey, when I get back tomorrow, she'll still be there. I'll say I love you. And she passed on the way back to go see her. Mm-hmm. And, to this day, you could see the regret in his eyes. Mm-hmm. That he lost that chance to say I love you to her before she passed. So yeah, I mean, I try to tell them every day that I love them. I cherish the moments when I drop them off. I make them give me a kiss before they get in the car. And then, when they get back to me, it's, let's go home. Let's do homework. Let's see what the day holds for us, and get them to bed, pray with them before bed, and give them a kiss, and then go to bed and do it again, the next day. So I think you just have to, I think for us, the good thing about our industry is, life is short. Mm-hmm. You think you're healthy at 49 today, you'll be gone tomorrow. You think your 1-year-old is promised a long life. They're not. You think the 8-year-old is going to die tomorrow, and they may live another 20 years. So you have no clue what tomorrow is going to bring, or even the next 5 minutes. So you just kind of have to cherish it. And it's hard. It's easier said than done. You just got to realize that tomorrow's never promised. I mean, our next 5 minutes is never promised.
Yeah. Well, that seems like a great way to end it. I mean, I think it's a true sentiment, the idea that we're never promised, and we need to cherish the people around us, because, in this world, the people around us are the most important part. Right. Well, thank you for joining me, man. It's been a pleasure. Your life and career is fascinating, and thanks for letting me in, behind the curtain a little bit.
Absolutely, man. I appreciate it, Jake. Thank you for reaching out to me, and hopefully this pod gets in the ear of someone and maybe changes the way they see life, or, gives them a little hope if they're not feeling great about kind of their life trajectory, and just give it another day. That's all it is. Something may pop up and change the way your whole life's going to look.
Awesome. Thank you very much, man.
All right, Jake. Appreciate it. Thank you.